You're watching Cetome TV. Knowledge is power.
So the causes. One of the main causes is, believe it or not, ovulation.
Oh, being a woman.
Well, being a woman doesn't necessarily mean ovulation.
Okay.
So what happens is the number of ovulation cycles you have. If you have a lot of ovulation cycles, then you have a higher risk of high-grade serous. And this is because in ovulation, you have something called a cortical inclusion cyst.
Okay.
And that can be a cause of high-grade serous. So a protective effect, obviously, is to become pregnant, parity, and breastfeeding, because these stop the ovulation cycle. Now, this is where oral contraceptives are beneficial too, because they also stop the ovulation cycle. And so they have a protective effect.
I was wondering about that. Yeah.
So that's the main cause. There's a lot of other causes.
Okay, so you don't have to become pregnant, just so you know. You could take birth control and have definitely. Certain types of birth control.
Yes, exactly.
Yeah. Okay.
Yes. Now, hormonal therapy during menopause is known to increase your risks.
Okay.
Now, I want to be specific there because, we had an excellent question just recently. A woman was asking about the use of estrogen creams, and so on, hormone-based creams.
Okay. As a potential cancer cause?
Yeah, because a lot of women use these through menopause, use them on the genitals and different areas and so on. And so I did look up some studies, and actually, even if you have estrogen-positive breast cancer, these creams do not significantly affect it.
Oh.
Yeah, so you can still use these creams safely.
Well, that's good.
Now, one of the reasons too is the creams are typically signaling for estrogen receptor beta, whereas estrogen receptor alpha is what drives most estrogen-based cancers.
Okay, well, that's good. That's such helpful, that mechanism.
Yeah, understanding the mechanisms.
Yes. Okay, so the creams that women might use
for menopause,
seem to be okay because the ER beta is.
I think there was maybe a 1 or 2% increase, but it wasn't even really well established.
Right.
So even if you have breast cancer, you can still use them.
But you did say something before that about hormonal therapy during menopause. Did you not say there's something about that can be okay?
Yes.
So how is that not this cream?
Because the cream doesn't enter the blood supply.
Okay. So the cream, because it's topical, it'll help with certain symptoms. Okay, like pain management.
Yes, pain management.
Okay, yes. But the hormone replacement therapy enters the bloodstream, and so it has a very different effect.
Very different.
Okay, thank you for clarifying that. Yeah. Okay.
So another cause is polycystic ovarian syndrome.
Oh.
And lots of women do have that, so you want to be on the lookout for that.
Okay.
I think it doubles the risk of high-grade ovarian, endometriosis, and it can also endometriosis can also be a risk for various reproductive cancers. Another one is PTSD, or as you would refer to it as trauma. So there's a study where they looked at PTSD in soldiers, female soldiers, and they found that if they had 6 or more symptoms of PTSD, they had a 2-fold increase in their risk of ovarian cancer.
Wow.
Quite significant.
Yeah. Wow. So just that, and the mechanism there is.
I would assume it's hormonal. I would assume it's something to do with the stress hormones.
High levels of cortisol.
Cortisol, that's what I would assume. I don't have all that information.
Can also be coping strategies, as we were talking about earlier. Oftentimes. But yes, I can appreciate if you've experienced trauma or you're reliving trauma in the present day. That's going to keep those cortisol, those stress hormones high.
Yes. So another interesting study, and we're seeing this so much, and I think we should actually have a microbiota section for every show.
Okay.
Because it is the new, it's the new area of research.
Okay. Tell us more.
So when they looked at the microbiota of ovarian cancers, and they looked at different bacterial species, and they found that one thing was common with ovarian cancers specifically, and they looked at women over 50 with ovarian cancer, high grade serous once again.
Okay.
And they found that there's a higher prevalence of something called the O community, O type bacteria,
Okay.
and a lower level of the type L, which are lactobacillus.
Okay.
And that was compared with women with ovarian cancer under 50.
Okay.
Now, when women also had a BRCA1 mutation, they also had a higher likelihood of having more of this O and less of the L.
Huh.
And then also a younger age of cancer was also associated with that, with a higher O and a lower L. So
you'll get it earlier if you have the higher O type bacteria.
Exactly, or if you have a BRCA1 mutation. Okay. What they found is that this high proportion of lactobacilli actually causes a lower pH in the vagina region, in the ovaries and so on. And so the lower pH, I believe it was a pH, quite low, definitely favored this protective bacteria and reduced the amount of the damaging bacteria. Yeah, of the O type.
Ah.
Yeah, so obviously this goes in direct conflict with the alkaline diet philosophy.
Right. But just for those of you at home, do not rush out and try to massively modify your pH, because not only is that physically impossible, it will kill you. Right.
Yes, exactly. So alkaline diet.
Yeah. But if I did want to have more L and less O, which is what you're saying, right?
I think a probiotic might help that.
Okay.
I don't have a lot of experience with this, so I'm just learning myself. So
you're going to follow up with us, so we can make another video and give you a heads up there. But it couldn't hurt.
We don't have the data.
Probiotic.
We don't have the data for a probiotic yet.
Okay.
And obviously you want to look at what's in the probiotic, but we're starting to figure these things out.
And if you're thinking from a prevention perspective, then trying to make sure that you have that nice balance of healthy.
Well, interesting enough, the healthy microbiota comes from a vegetable Mediterranean-based diet.
There you go.
Yeah, that's one of the main things. You have more diversity, and that keeps everything in check. And then having a more limited diet, fast foods, lots of sugars and so on, can give you a negative, microbiota for cancers.
Right.
And all other diseases too.
Right.
So, once again, it's down to eating those foods, those important, Mediterranean-based foods.
Healthy veg. Right.
Yes.
Yes, because that just seems to have so much influence on so many of these other things. Yeah, and it is something you have total control over for the most part, depending on where you live.
You just have to teach yourself to like vegetables.
Yeah.
So another one is assisted reproductive technology, called ART, and that's a blanket field of reproductive technology.
Okay.
So in women that had ART, they were found to have a higher rate of ovarian cancer. But this ovarian cancer rate occurred about 15 to 19 years after they had the ART. So that was quite an interesting.
So we're not just talking about when you're talking assisted reproductive technology. So these are things like in vitro fertilization,
and the hormones involved in
hormones.
that.
And then it seems 15 to 20 years later, there is this
increased
side effect.
Yeah, and no, it wasn't just high grade serous. It was actually a few different types of ovarian cancers too.
Okay.
So
there's other factors at play, obviously.
Right.
Wow. Do you have a number for us? What is the percentage?
I don't have the numbers.
Okay.
No.
All right.
Sorry.
Okay, but something to be mindful of.
Now this also, as you know, for women that haven't had babies or who are infertile, also have higher risks. And so ART was associated with about the same ovarian cancer rates. I do know that.
Oh, okay. All right. As people who did not have
babies,
right, and therefore, as you were saying earlier, it seems to be directly related to how much you ovulate through your life.
Yes,
and this would affect that for sure.
That
so for those who already have had some sort of assistive reproductive technology, something like that, which maybe it was last year or 10 years ago, and you've just heard Alex say that can increase your chances of developing this cancer.
Yeah, and it wasn't a huge increase.
Okay.
It wasn't like a substantial increase, but it was a noticeable. It was an increase.
It was measurable.
Measurable, yeah.
Okay. Where I was going with that is, do not despair. Do not despair. There's so much you can do with diet, with exercise, with lifestyle changes, and there's genetic testing that you can have that help before cancer ever develops, to see if you do have some of those genes that might put you at a greater predisposition for developing cancer down the road, which can then help you to A, keep an eye on it, and B, make some significant changes to certain things that might exacerbate systems in your body. So whenever you hear Alex talk about increased risk of this, that, or the other thing, and it pertains to you, do keep in mind there's still lots you can do for prevention, and just to keep an eye on things, so that if cancer were to develop down the road as a result of something like this, you're on top of it super early, and you have the best possible outcome.
Yes, definitely.
Yeah.
Definitely.
Thank you for watching Ketome TV. Subscribe below and stay informed.